Hi, I'm Dr. True. We're going to talk today about immune system and how to boost your immune system, because nowadays we have the COVID-19 around and we all want to boost our ability to fight off infections, fight off those bad things that might hurt us. Right now we're talking about the coronavirus, and it is a bad thing, maybe not as bad as what they're saying, but anything you can do to boost your immune system to be able to fight it off is a good thing. And we have lots of different options that you might want to participate in. One of these options, of course, is supplements. We can do some supplements. Curcumin. Curcumin is one of those supplements that works very, very well to boost your immune system. Curcumin has been used for years and years to boost the immune system. It has a lot of antioxidant functions to it, has been shown to help out, decreases a lot of chronic medical diseases because it is such a good immune booster. And then another one is green tea. That's a similar type of thing. But one of the things that's really interesting is vitamin D. Now, vitamin D is very, very, very important that you get an adequate amount of vitamin D. As a matter of fact, recently they had a study that said if you have really low levels of vitamin D, the incidence of you having a bad problem with coronavirus is like 19 times greater. So you really want to make sure your vitamin D level is bumped up to maximum amounts. Another thing is, of course, eat good foods, lots of fruits and vegetables, and exercise. Have a good life, do a good lifestyle. But we have another thing that's really interesting, and that is called a concept of peptides. Peptides are chains of amino acids. They are signals. What they do is they signal your body functions in different areas to do certain things. One of the peptides that has been around for years is insulin. We all know that insulin signals the ability of your body to utilize carbohydrates and sugars. So that's a peptide. But there are some other peptides that are off-label that work really good to boost your immune system. One is called thymosin. Thymosin comes from your thymus gland. Now, your thymus gland is really pretty big when you're a child, but as you get older, the thymus gland reduces in size. The reason why that's important is we all know that children, they are very resistant to a lot of infections for the most part. Matter of fact, even with the coronavirus, they say most kids, they don't even have any symptoms because their immune system is so good. What happens is that your bone marrow produces certain immune cells. They're called T cells. And these T cells go to the thymus gland and they're activated. They still work. They work before they go to the thymus, but not as good. When they're activated, boy, they're really powerful and strong T cells. So the thymus gland is very important, but the problem is as you get older, the thymus gland sort of shrinks, so that by the time you're around 50 to 60 years old, there's a very small amount of thymus there. But we can use the preparation, the peptide that comes from the thymus gland to boost your immune system, to get those T cells activated. And that's a preparation called thymosin. And there's several different ones, but one's called thymosin beta. And it has a lot of pretty cool immune system functions that help to make you stronger as far as your immune system. And it has been shown to maybe help in those people to prevent the coronavirus from causing a bad infection. It's been used a lot for to decrease the incidence of severity of the coronavirus. So you can boost it up as a preventative thing. These peptides come in small little vials. They're injections, such as this little vial right here. And you give yourself a needle and a syringe. You give yourself a small little injection of this. And if you notice, the needle is very, very small. You can hardly even see this needle. It's almost like an eyelash. So you just give yourself a very small amount of this, and you can get it anywhere. You can blow up your skin, give it to you there. You can give it anywhere you want to, but it's a very small amount. You can do it a couple times a week just as a preventative thing, just to kind of boost it up. If you get coronavirus, you do it every day. We use the thymosin beta specifically for the coronavirus and help you boost up your immune system. An interesting thing about this, though, is one of the things that the thymosin beta can do is to help your hair to grow. So a lot of people that have a problem with their hair growing, and part of that may be an inflammatory reaction that occurs as you get older. It just doesn't want to grow as well. Well, the thymosin beta actually helps the hair to grow too, and you can be given several ways. You can do the little injections if you want to, but we can also do injections right into your scalp that boosts the growth of those follicles. How this functions. So in essence, peptides do a lot of different things. They're chains of amino acids that do signaling. They signal different parts of your body, and we can use them for a lot of different things. Right now, we're using a lot of these for the coronavirus because we got to get back to work. We want to feel good. We want to get protected. I'm Dr. Truly. If you want more information, please look up at my website at trimd.com.